Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to those first responders and public works employees who have been busy the past few days preparing for inclement weather. We have been very fortunate in Knox County to not receive the severe weather that others across the state and the country have seen, but we remain thankful to these folks for always preparing to ensure Knox County citizens can stay safe. For our vaccination update, we continue to provide vaccines every day this week, including second dose and community-based clinics to reach high-risk individuals who have less access. We continue this week to vaccinate those in the first two priority groups, including those 70 years and older. As we stated Tuesday afternoon, we will move in coordination with the state to open the eligibility groups to those 65 and older in phase 1B, which includes K through 12 teachers and staff, as well as child care center staff and other first responders who were not in the previous phases. This will be effective on Monday, February 22nd. And while we know it is very encouraging that more people will be able to receive this much desired protection, we want to stress that eligibility does not necessarily mean access. We are continuing to see an extremely high level of demand for this vaccine, and unfortunately, the supply is just not there yet to meet it. We encourage everyone to please be patient. We are continuing to work with our community partners to roll out vaccine as quickly as supply and resources allow. And as a reminder, if you signed up on our wait list but have already received your vaccination, please call 311 or our public information line at 865-215-5555 so that we can take your name off the wait list. And this will let folks who haven't received their vaccine move up the list. Before we get into benchmarks today, we want to discuss why we delayed in updating yesterday's case numbers. During a routine epidemiology data review, it was noticed that a number of probable cases have been categorized incorrectly as confirmed cases. This specific error occurred because antigen tests had been mistakenly coded as confirmed cases when they should have been coded as probables. We refrained from reporting the numbers yesterday so that this issue could be corrected and addressed fully. The numbers reported out today reflect the accurate classifications. It is important to note that the error occurred only on one day and was quickly addressed and corrected. Additionally, no part of the response to the individuals was affected. Since probable cases are treated the same as confirmed cases, they were appropriately interviewed and were given guidance on isolation and quarantine, just as they would have anyway. As we've mentioned before, providing data in real time like this, like we've been doing over the course of the pandemic, is not typical. Reporting this data out every day is a huge lift for our team, and we are very proud of the way they quickly identified a potential issue and worked with appropriate folks to ensure that it was immediately corrected. And now we'll move into the local situation. We have 78 new confirmed cases since yesterday's report and 49 new confirmed cases reported yesterday from the day before. 1,847 are active cases. 59 Knox County residents are currently hospitalized. And sadly, we have 3 additional deaths to report today, bringing our total to 520. Now we'll turn towards the benchmarks. All of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. And moving to the first benchmark, sustained reduction or stability in new cases for 14 days. Over this time period, we saw daily new cases drop to approximately 120 cases per day, down from the previous reporting period, which was around 127. As encouraging as these numbers are, and they are very encouraging, the new cases per 100,000 and the percent positive is still higher than what we would like to see. We will review those figures in just a few minutes under our supplemental data. Once again, we want to caution folks against accepting a high level of cases as normal. Even though these are lower numbers than they have been in recent weeks and they were before the holidays, an average of 100 plus cases per day is still greater than what we'd like our community to see. Because of this, we represent this benchmark as yellow. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding testing, we saw a dip during this time period. As we have continued to say, we are hopeful that this is an indication of lower burden of disease across the community, but we will continue to keep a close eye on it. We continue to urge anyone who has symptoms or who has been exposed to COVID-19 to please get tested. Regarding lab turnaround time, this number continues to be consistently at less than 2 days for the community. Because of the lower testing numbers coupled with our shorter lab turnaround time, we still are representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. As we've mentioned, we've changed up this benchmark to better reflect current capacity. As the bulk of the response activities have shifted from case investigations and contact tracing to vaccine distribution, this benchmark needed to change to reflect that. The goal is to increase vaccine distribution across the county and to continue to consistently do that. For this benchmark, we are looking at the full public health system, not just Knox County Health Department, but also all of our community healthcare partners that are vaccinating folks. This graph on this benchmark will be used to show trends related to vaccine administration by provider type. We are working to build standard deviations into this data so we can more specifically talk about the trends, but need a little bit more time to do that. However, as you can see from the graph, vaccine distribution continues to trend in the right direction across our community. For that, we are very happy. This week, we are representing this benchmark as an improving yellow. We are heading in the right direction, but we recognize that demand for this vaccine continues to drastically outpace the supply. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this time period, we have continued to see hospitalization numbers decrease. This is encouraging and something we hope to continue to see happening. After speaking with our hospital providers, they have recommended that this benchmark be represented as a stable yellow. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan their response together to best serve this community. The decisions regarding on how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. During this time period, we've seen 32 deaths associated with COVID-19, which is down from 50 in last week's report. Since the beginning of the year, there have been an average of 4.2 deaths per day, but an average of 2.5 deaths a day over the past 14 days, so our reporting time period. So this is definitely trending in the right direction, but we want to see it to continue for a little bit further or longer. This information leads us to represent this benchmark as red. We hope to see this moving into yellow in the coming weeks. Under the supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of today, our 14-day trend line shows 23 new cases per 100,000, and our 7-day trend line shows 19 new cases per 100,000, which is down from last week, and again, indicating that we're moving in the right direction. But it is still above the threshold as identified by the Board of Health. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average percent positive in Knox County is 14.79, which is slightly up from last week, but still above the recession barriers as identified by the Board of Health. And now I'll open it up for questions.
All right, see, we've got some questions already in the chat feature. The first we have is from Alan with Inside of Knoxville. People are scrambling for information regarding who has the vaccine and how to make appointments. Could a page be established, perhaps linked to the Knox County vaccination page that lists major providers and links to their registration or appointment portals?
Yeah, Alan, that's a great question. Tennessee Department of Health actually has that on their website, and our local sites are listed on that. And there is a spot on our website on the vaccine information page that links directly to TDHs. So we encourage people to go there to access that information.
From Brian Hornback, do the vaccine numbers at all area locations like UT Medical Center, East Tennessee Children's Hospital, and pharmacy providers part of KCHD vaccine numbers?
Yes, for Knox County residents. So it's pulled out of the state immunization reporting system. And so we pull it out for those again, Knox County residents. But yes, all the vaccines happening for Knox County residents. And as Dr. B is saying, even if they were vaccinated in another county and they're a Knox County resident, that's showing in the numbers. So that's why we talk about Knox County resident vaccinations.
From Megan with WVLT, will the expansion of vaccine availability to additional groups cause more delays for those 75 and older who have still not been vaccinated?
The hope is that as there's more access points, that there will be more access and more eligibility for those folks. But again, the supply has to be able to support that. And so we do encourage those folks that are in the 75 and older and the 70 and older to continue to seek out opportunities to get vaccinated if they haven't already. You can get on our wait list now. And so we can reach out to you when we get open up more appointments. So just again, encourage everybody to continue to seek out opportunities as they become available across the community. And that TDH website link on our website will help you find those.
From Brian Hornback, is your waiting list prioritized by age and priorities, or is it first come, first serve? And if so, why is it that way?
It's first come, first serve because all of the priority groups are in there as a group. And so in the current priority groups before Monday starts, the 70-year-olds and the 1A1 and 1A2 and all of those are in the same batch according to all the planning guidelines that we've seen. And they will continue to be that way. So it's first come, first serve. And then the new groups will roll in behind those next week. Again, we encourage everybody to sign up. And you have to be in a priority group to be able to even sign up on our wait list. So that's really how that structure works out.
From Cole with WBIR, says, thanks for transparency on the data discrepancy. His question was, assuming County Commission approves use of the old Food City, how soon would you look to start using it? And could we get a tour of it?
We'll have to follow back up on a tour. I'm sure we'll get back with you on that, Cole. How soon do we plan to use it? It has to be first week of March. Yeah, first week of March is when we'll have access to it if it gets approved. And so there'll be some setup time and such, and hope to be in there shortly thereafter.
Also from Cole with WBIR, what guidance are you giving to school bus drivers, substitute teachers, athletic coaches, and teaching interns who are confused about whether they qualify? Do they?
Yes, I believe every one of those lists do qualify. So if school bus drivers definitely do, interns that are working in the classrooms do, substitute teachers that are actively substituting do. So we encourage you to seek out opportunities to get vaccinated with and coaches do as well that are teaching and working in the schools. Recreational, rec league sports and that are not at this time. But if you're working in the schools, you qualify. Seek out opportunities as they begin to open up. We encourage that, and then we will encourage you to sign up starting Monday.
And a follow-up that Cole had was asking, do Knox County schools, county level administrators / central office staff who do not typically spend time in the classroom qualify?
Actually, the guidelines are for all school personnel at this point in time.
From Austin with WATE, how many people are currently on the waiting list for the vaccine through the health department?
There's a little over 10,000.
And another question from Austin was, has the health department noticed fewer people signing up for the vaccine since more places are offering the vaccine?
I don't know that we really can see that trend yet since we just got our wait list up and running, and it's kind of hard to see with what the other folks are doing as well. Yes, and Dr. Buchanan is asking me to remind folks again, I said it in the opening statement, but I want to reiterate, if you do get on our wait list and you do get vaccine somewhere else, please let us know. There's still resources that go into reaching out and contacting folks, and that takes extra resources if we don't need to. So please let us know if you've gotten a vaccine somewhere else so that we can get you off the list and let other folks move up.
Also from Austin with WATE, can you sign up for the wait list when the county hasn't announced a clinic day yet?
Yes, it is a living rolling list. So as long as you meet the current criteria that's there, you can sign up for it. So the 65-year-olds and the 1B folks won't be able to do that till Monday. But once you meet criteria, we encourage you to sign up. You can do that at any time.
From Allie with Knox News, how many people are you expecting to be added to eligibility on Monday?
We're working on gathering some information from our private school partners and daycare, childcare centers that don't have that one yet. But the 65 and older crowd, the total number for that is 75,775 people, give or take, in Knox County. So that is a large jump from the 70 and older crowd that we've talked about before. So there's going to be a large chunk of people entering into the priority groups beginning Monday, definitely in Knox County.
From Cole with WBIR, we know educators and people 65 and up are excited to begin getting vaccines next week. When do you expect to open the wait list to them? Is there a specific time?
The wait list is, my understanding, will be opened up at 8:30.
By 8:30 on Monday morning. And once again, folks, if they don't have internet or computer access, they can call in our public information line or 311. Also from Cole with WBIR, do you think the state moved to open the next phase too soon? In the Tuesday briefing, Dr. B said Knox County hasn't made as much headway as you'd like in the existing phase.
You know, the state's having to make decisions and looking at what's happening across the entire state. And so there really were a lot of counties that had already moved to that phase. And that just for them helps to limit confusion, and which is why we decided to go with them as well. There's also some logistics involved as far as some of the federal partnerships. They all have to stay in the same phase across the state as well. And so when the majority of counties start moving, it just makes sense for them to move into it. But that means that our residents, our Knox County citizens, are just going to have to be patient because we are one of the larger counties in the state, which means there's just more people to move through. And so we ask that you stay patient with us and continue to seek out opportunities as they arise.
From Brian Hornback, when Knox County citizens are vaccinated in other counties and that appears on your list, can't you then remove them from the wait list if they are on the Knox County wait list?
We can, and that's what we're doing in a lot of ways, but that is a very manual process. And so it's easier if up front, and it helps it move through quicker if people will let us know when they get vaccinated. So basically saying reconcile tennis with our wait list, which would take thousands of people. So you think about the thousands and thousands. So yeah, I guess I should say it's probably theoretically possible, but not something that we can put resources to doing.
From Cole with WBIR, previously KCHD has warned us, excuse me, not to normalize lower numbers for COVID as they were still higher than you'd like. Hospitalizations continue to remain much lower than the peak. At what point should we feel more comfortable about the numbers? Is there a specific threshold?
You know, we can probably look at, we've been talking about this a lot, the thresholds that the Board of Health had set for some for removing barriers and regulations. And so those are probably pretty good ones. So those are looking at, I believe it's 10 new cases per 100,000 and a less than 10% positivity rate. That's when we'll start feeling better. That still doesn't mean, and I want to reiterate this, that still does not mean that we stop doing the 5 core actions, that we are going to need to continue while we work through this vaccine process to wear our mask and continue to socially distance for the foreseeable future. But it will be making us feel better as we see ourselves getting closer to those thresholds.
All right. Any further questions, please go ahead and submit them now. All right. Another question from Cole with WBIR. How much of a headache is it causing when people on the wait list have already gotten vaccines somewhere else?
You know, it just takes extra time to get through those and reconcile all of that so we can continue to move to people who need to get vaccinated. And so, again, we really ask folks to let us know when they've gotten the vaccine somewhere else so we can get them off that list. It just will expedite the process and smooth it out for everybody else.
All right, any further questions? Please go ahead and submit them. All right, I'm not seeing any other questions come in, so thank you all for your time today. We hope you have a great and safe rest of your week and weekend.